Well, good morning, everybody. Thank you all for joining. I'm Nirav Shah, the director of the Maine CDC, and I've just had the opportunity to take a moment today to spend some time with the team and the volunteers that are operating the vaccination site here at the Portland Expo. It's in partnership with Northern Light Health and Mercy Hospital. And I was extremely impressed on a number of fronts, and I'd like to take a moment to just highlight a few of the observations that I've had. More generally, not specific to the Expo, large-scale, community-focused vaccination sites of this nature are our way out of the pandemic. We always talk metaphorically of the light at the end of the tunnel. And vaccines are that light at the end of the tunnel, but it's large-scale sites of this nature that are the vehicle that will get us out of that tunnel. That's because we're in a situation where case counts are rising, positivity rates are going up, hospitalizations are going up. The virus is still very much around us. And although masking and physical distancing are just as important as they have been, vaccinating is our focus right now, because that will help us ultimately tamp down on the pandemic. That's why sites like the one that we're here today talking about at the Portland Expo are so critical. I want to make a couple of observations. Sites like this, they give the appearance of being quiet and almost sparse, when in fact, there are about 215 to 250 people per hour that are going through that site. On any given day, anywhere from 1,000 to 1,200 people per day are getting their first or second dose of Pfizer vaccine here. But because of the orientation, because of the setup, because of the spacing, they make it seem as if you're the only one there. It's quite amazing, but it's a testament to how well thought out the entire site is. The other thing that I think is important is where we are right now, physically. We're in a part of the state and a part of the city where there's a lot of folks who are walking here, where there are folks who are of low income or who are otherwise unable to access something in Sanford or Scarborough or Bangor. The proximity, the centrality of this location makes it a prime opportunity for a lot of folks who might not otherwise be able to go elsewhere to get their shots. The third thing that I think is really critical and what differentiates this site from many others, perhaps all others, is the targeted outreach that they do to various members of different communities across Maine. Just in the time that I was visiting with folks at inside at the Expo, we had a community health worker who works with many of the Spanish-speaking Latinx communities in Maine come up and talk about how she's working to get members of her community specialized times to come in as a group where they can get vaccinated. We also heard that a community that's very near and dear to my heart, the Cambodian community, has taken advantage of that opportunity already. What this opportunity means is that groups who are of different ethnicities, of different backgrounds, who may not feel comfortable on their own, one-on-one, going and getting vaccinated, can come in as a group. And our colleagues at Mercy and Northern Light will accommodate that. They'll allow for scheduling of 10, 20, 30, 50 people all at once who can come in as a group. But we all know from our own experiences in healthcare, getting in the door is only the first part. Navigating the entire system is really important as well. And so what our colleagues here at Northern Light have done is make sure that when those groups come in, they are provided cultural brokers, wayfinders, to help them go through that entire process of going from getting here to getting their shot. I think that's what differentiates this site. And it's important because although what we talk a lot about is how quickly we vaccinate, it's equally important to focus on who we vaccinate. Who we vaccinate is just as important as how quickly we vaccinate. And I commend the team here at Northern Light and Mercy for their focus on disaffected, disempowered communities, helping them get scheduled in blocks, helping them come in, helping them navigate the process, and helping them ultimately get their shots. So I commend them for that, and I commend them for the entire operation. I gotta say, it's a well-oiled machine. That's the only way to describe it. It was interesting because when I was coming in, there were some people that were walking in with me, and as I visited sites, I use the people that I walk in with as kind of my pace setters, and I'm curious to see if they get done with their process before I'm done with my walkthrough. And without fail today, everyone I walked in with was walking out before I had even made my way halfway through the building. The other thing that's important about sites like this is just how happy they are. These are, right now, bar none, the happiest places in the state. And that was evidenced by some of the people I talked to. I talked to a woman today, just a little while ago, who got her second shot. And it happens to be just about 2 weeks to her birthday. So she's going to be able to celebrate her birthday with her friends in a private residence, fully vaccinated, without the need to wear masks. But I actually asked her, what are you going to do that's different? Because you could have gotten together with your friends anyways. And she said, now that she's been fully vaccinated, she's going to attend church. She had been cautious about going to church because of fear of potentially getting infected. But now that she's been fully vaccinated, she will, for the first time in over a year, go to church right around her birthday. I talked to another gentleman who's a small business owner for whom, and he told me that about a year ago, his doctor told him, sir, if you get COVID, you're not going to do too well with it. And now that he will be soon fully vaccinated, it meant for him that he can get back to managing his small business there every day rather than from afar. So vaccines and vaccinations are really important. Again, I commend the team here at Northern Light Mercy Health for making this site possible. I will stop there and take questions. Joe?
Sorry.
Yeah.
Go ahead.
Yeah.
You said the numbers are continuing to unfortunately climb. We're hitting school vacation week, so I guess our concerns are, do you feel the numbers will continue for a couple more cycles now?
It's a risk. It's hard to know what may happen as a result of vacations. That is a risk. It's certainly a concern. After other vacation periods, whether it was Thanksgiving or then later in the December holidays, we did see increases, and that's not surprising. What I guess, the way that I think about that is that it's a risk we know about. And what we've seen in the pandemic is that we have we bat a pretty good average when it comes to predicting when there might be events that will lead to surges. The reason I say that is that in public health, what's predictable is also preventable. So yes, we're coming up upon school vacation time, but that should not necessarily mean that our case counts go up. Families can take steps to stay safe. They can still wear masks. They can take vacations that don't necessarily expose them, and critically, they can get tested before they leave, while they're on their trip, and when they come back. Joe?
Okay, so do you think there's any connection between the expansion of gathering limits indoors at bars and restaurants and then the reopening of bars to the latest surge?
It's certainly a hypothesis, Joe. I don't want to discount it as a hypothesis outright, but I think there are some questions that come up in connection with that hypothesis. For example, the increase in cases that we are seeing is relatively uniform across the Northeast, with states having differential schedules for reopening. So that's one question that comes into the hypothesis. If it were a direct function of that within our state, then how do you account for differences in other states where they were on different reopenings? It's a scientific question we have to ask. The other thing is that specifically with bars, what we saw a lot up until recently is that many bars converted to restaurants by offering food and thus remained open with various restrictions in place. But it's not as if bars had been shuttered and then the light switch was just lifted. It was a little bit that they were open, and now that maybe capacity changes have come up, they've been a little bit more open. So I don't want to rule that out as a hypothesis, but I don't think it's the leading candidate. I think you were on yesterday. You and I talked yesterday. Based on my conversations with some epidemiologists as well as other state health officials, I think right now the leading candidate seems to be that the increase in cases is a function of variants that are more transmissible.